Now you should be comfortable with how to give 30 chest compressions. We will look at how to give 2 rescue breaths. Mouth-to-mouth breathing is optional and is discouraged in healthcare settings, as there should be barrier equipment available. Outside of clinical settings where this equipment may not be available, it is okay to give compression-only CPR and not to give rescue breaths at all. This will still circulate some oxygenated blood, which may keep the vital organs viable if advanced life support arrives quickly. How to provide rescue breaths using mouth-to-mask breathing. Open the mask and attach the non-return valve. This stops secretions from the person getting to you. Place the mask with the pointed end over the person's nose. Apply firm pressure to create a seal around the mouth and nose. At the same time, use the head tilt chin lift to open the airway. Give 2 breaths, allowing about 1 second's inspiration between each breath. Make sure you are inflating the lungs by looking at the rise and fall of the chest. Do this twice and then immediately continue with 30 chest compressions. How to provide bag-to-mask rescue breaths. Open the airway with the head tilt chin lift or jaw thrust. Place the mask over the nose and mouth, ensuring a good seal. This is not always easy, especially if you have small hands, so practice this skill regularly if possible. And if there are more than 2 rescuers, you can hold the mask in place while a 3rd rescuer squeezes the bag for you. Deliver breaths by squeezing the bag by a 3rd, slowly and gently. Give 2 breaths, then immediately continue with 30 compressions. Give 2 breaths in cycles of 30 compressions to 2 breaths. If you are in a healthcare environment, you should attach supplemental oxygen to the mask, always working within your scope of practice. For an infant and neonatal bag valve masks are available and should be used by health professionals who are proficient in their use. If you have to resuscitate an infant outside a clinical setting or where appropriate mask devices are not available, you may use mouth-to-mouth breathing. You should cover the nose and mouth of the infant with your mouth, and breaths should be gentle. Look for gentle rise and fall of the chest. The ratio of compressions to breaths is still 30 to 2, but you should use the 2-finger or 2-thumb method already described to press a 1/3 of the infant's chest depth, which is about 4 centimeters.